coming out of Washington. We continue our coverage as lawmakers failed to reach an agreement to fund the federal government by midnight on Tuesday night, triggering a shutdown on Wednesday. At the heart of the deadlock are health insurance subsidies, one being tax credits that have made health insurance more affordable for millions of people since the COVID-19 pandemic. The subsidies go to low and middle income people who purchase health insurance through the Affordable Care Act, are slated to expire at the end of the year if Congress does not extend them. About 90% of people who purchase health insurance through the Affordable Care Act currently benefit from these subsidies. As The Hill has reported, the cost of health insurance premiums could skyrocket for 22 million Americans if subsidies are allowed to expire.
And with that, joining us now to talk about the shutdown is Democrat Sylvia Garcia, who has been serving as the U.S. Representative for Texas' 29th District since 2019. Her district covers much of eastern Houston. If you have a question for the representative, give us a call, 713-440-8870. Representative, thank you so much for joining us today.
Welcome to Hello Houston. We're glad you're here.
Well, I'm glad to be home. I left Washington last night, and we're now on day 2 of the Republican shutdown. So here with everyone, and everybody's asking what is going on, so I'm prepared for any questions that you might have.
So,
Sorry,
I was going to say, first, before we get into all of the questions people may have about it, if you can explain where we actually are at. People misunderstand where the shutdown is, which branch of the government has voted okay and moved it forward, where exactly we are and how we got there. Unless
and I just want to follow up something. I found it very interesting, Representative Garcia, that you immediately said it was the Republican shutdown. Why is it a Republican shutdown?
Well, it's a Republican shutdown simply because they're in charge. I mean, they control the House, they control the Senate, they control the White House, and some would argue they control the Supreme Court. So when you control all the branches of government, it's under your control, your agenda, and what happens, you got to own it.
Okay, take us back. What's happened?
Well, the House voted on a bill that did not include protecting health care for Americans, particularly the 22 million that was referenced in the introduction. 22 million Americans will stand to have their Affordable Care Act premiums go up, their deductibles go up, and their co-pays go up. Some will simply not be able to afford it, will end up not having insurance. Secondly, part of it also includes everything that was in their, what they call the big beautiful bill, and we call the big ugly bill, because it was ugly because it had the highest cuts in the history of the Medicaid program to Medicaid. It also made some cuts to Medicare and other programs that also protected your health care. So it's about protecting your health care, and it's about lowering prices and about canceling the cuts. Because the big ugly bill also provided for a lot of other cuts that were meant to get the dollars to be able to sustain the cuts to the taxes of billionaires in this country.
I want to just clarify so people follow and understand.
Sure.
So that's referred to, the bill that you're talking about is the CR, the continuing resolution.
The continuing resolution, and that just simply means that all funding in the budget, this is a budget issue, it's about the dollars, expires on September 30th. If nothing happens, then there's no money to run the government. That's why they call it a shutdown. It's really just a disruption of funding, but you know, we don't want to get too technical here. Bottom line, there's no dollars in play.
So the CR is an agreement to continue funding what currently is being used. Currently,
right.
at
you
the levels
sustain
we
the
have,
current budget. You just
to give
say
you
we'll
more
extend
time.
it to give us more time to negotiate, more time to discuss, whatever it is. It's really just kicking the can down the road. You don't want to decide today. It's kind of like an extension.
But in addition to it just being continuing the funding in the moment, Democrats wanted some additional understandings put into the CR to agree to it. Is that correct?
That's correct. And it's the same things that we've been talking about since March. In March is when we kicked the can down the road and said we'll discuss it before the end of the budget. But Republicans are just flat unwilling to sit down and negotiate. Just think about it. 8 months have gone by, and not once had Donald Trump agreed to meet with Hakeem Jeffries and Chuck Schumer to discuss these issues. They just flat refuse.
And the last point on this is, I don't really mean the last point. We'll talk a lot about
No, let's
this.
talk some more.
But my question is, why don't the Democrats simply agree to the CR, the continuing resolution, and then while those 7 weeks are playing out, because I believe it's for a 7-week period, that's when you negotiate what will be in the final bill for funding moving forward? Why is this being put into the CR instead of saying, keep things as they are and we will continue to talk about this and negotiate?
Well, it's simply, we voted against it in March, so why would we vote for something today that we voted against in March? Because, again, they don't want to discuss protecting healthcare, lowering prices, and cutting the cuts. It's really simple. It continues to hurt Americans. It continues. 22 million people will lose these premium credits. 22 million. People will go from paying, maybe $200 in for their insurance to having to pay $600 or $1,000. It really will hurt people, not to mention, again, some of the cuts that are already in there because of the big, ugly bill. People might lose their food stamps. We know there's enough money there through October, just like employees are paid through October. But after that, what's going to happen? Mm-hmm. People need to know that they can depend on us, and we should not leave people there out on their own on the streets. It's really pure and simple.
To Ernie's point, and you're bringing up March, didn't Chuck Schumer catch a lot of heat for his agreements back then? He said, okay, we'll kick this can down the road. And then the Republicans didn't come up to the plate like they said they would.
Well, and that's the second reason is that if they haven't really sat down to negotiate and have refused to negotiate with you for 8 months, what makes you think that if we do this extension for 6 weeks that they really are?
Right. So you don't trust them?
No, we don't trust them. I mean, would you? Schumer, our leaders, Hakeem Jeffries and Chuck Schumer, go to a meeting. Nothing really happens. All that happens is they put up this horrible racist meme of Hakeem Jeffries with a sombrero and a mustache with mariachi music in the background and Chuck Schumer saying some really ugly things about Democrats, all on AI. How can we take that seriously? So that's even worse than juvenile behavior. So it's really difficult to work with a party that, A, we're out of town. We were there. Votes were scheduled for Monday and Tuesday. They canceled them and said, oh, no, we're not coming back until the Senate does something. Well, what if the Senate had done something Monday? They would have been asleep at the wheel. They wouldn't have been there. We were there, willing, ready, and able to fight to protect health care for all Americans.
To that point, the Washington Post came out with an article today, Mark Thiessen. The headline is Democrats shut down the government to protect COVID spending, not Obamacare, that there was the American Rescue Plan tax credits from Biden's 2023. And those are the ones that are going to expire January 1st, and that this is much about trying to protect that than it is health care. Is that article that came out completely false?
No, that's a surprise to me. I've never heard anyone make that argument. This is about the Affordable Care Act.
Yeah. That's why
tax
I asked,
credits,
because it's so
which,
counter.
by the way, have broad support from employers, people who have the program. I mean, it's going to impact 22 million Americans. That's more than half of the people, including me. Most people think members of Congress have the Cadillac plan that the taxpayers pay for. That's another myth. I pay for my own insurance to the marketplace through D.C. We have to pay for our own insurance. Mine will probably go up together with everybody else's.
Will you still get paid during the shutdown?
I think that we will continue to get paid members of Congress because we're not employees.
And what about ICE agents?
I don't. It depends on the president has not laid out yet the guidance on what agencies will be doing. What they'll be doing. It's frankly up to him because he's in charge of the agencies. So I think he's probably going to furlough some people, and he may keep some on payroll. It's up to everybody. Like I decide what happens to my office. Every member of Congress, because we're sort of our own employer. So, like, I'm not furloughing anybody. Everybody does get paid through the end of this month because we're paid monthly and they already got paid. So everyone's okay through October. It's November that's the real question about what will happen. And I know there's a lot of I've signed on to a number of bills to make sure that military families get paid, including the Coast Guard.
You're listening to Hello Houston. We are talking about the government shutdown. Joining us now is Democratic Representative Sylvia Garcia, who's been serving as the U.S. Representative for the Texas 29th Congressional District since 2019. Her district covers much of eastern Houston, and you are more than welcome to join the conversation at 713-440-8870. Now, Representative Garcia, you're talking about impact, and you're talking about the 22 million Americans that could be affected. However, this shutdown is setting the stage, as you mentioned, furloughing of hundreds of thousands of federal workers and the shuttering of a slew of key programs and services. Do y'all truly think that this shutting down the government is a long-term solution for what y'all are trying to achieve?
Well, we can sit at the table. Now, remember, the last shutdown was in 2019. I was sworn in during a shutdown. It was a Trump shutdown then, and it's a Trump shutdown today. That was the longest shutdown in the history in the last 40 years. It lasted 35 days. I think this one will probably last between 2 and 4 weeks because, again, after the 30 days, because employees have been paid for a month in advance is the way it works. Their checks cover through this month. It's November we have to start worrying about. So we will do everything it can. So again, we've been ready, willing, and able, as they say in contract law, to sit down and talk. But you can't talk to people who are not serious and are more about memes and racist remarks and demeaning people than they are about really getting to work.
So what's it going to take? What did it take in 2019 for them to come to the table, and what's it going to take this time?
I can't, frankly, at the top of the moment, I can't recall what it took. I think it's the reality that after 30 days, things really sink in. But on this one, because of the way that insurance companies work, notice is already being sent out about the increases in premiums. They started going out early this week. They'll continue to do that probably till about the middle of the month because, again, they work a month in advance. So people are going to start feeling it and having to make choices because for a lot of seniors, open enrollment is the time that the government gives you to decide which insurance plan you want for Medicare. All of that is November 1st. So this is top of mind for everybody. So I for one, again, I'm ready, willing, and able, and I would sit down today because this is putting a lot of people's health at risk. When you hear the stories, Ernie, about people who depend on Medicaid for their cancer treatments, or they depend on Medicaid to be able to keep their aunt in a nursing home, and now all of a sudden this is all being stopped. And let's be mindful and fair. The VA hospital will still be there. All of these facilities are there. They just may not have the staffing because of the furloughs, and it depends again on the agencies who they furlough.
Mike Johnson insists that the ACA covers illegal aliens, as he said.
Well, I know, and he insisted that Haitians eat cats. It's just ludicrous. No, it's ludicrous. Sure. It's a lie, and they know it, but they perpetuate that lie because it helps them. I'm going to tell you something. I was a social worker before I was a lawyer and any of these other things. Even back when I was a social worker, undocumented immigrants couldn't get food stamps, couldn't get on Medicaid. There's a citizenship test with all of these programs. You can read the entire proposal of the Democrats. There's nothing in there, not one thing that could even lead you to believe that we want to do that. It's just a flat-out lie.
And if I'm not mistaken, it was Ronald Reagan who said that if somebody needs care, it's our responsibility to take care of them. If someone comes into a hospital and is in a life-threatening situation,
we can't leave them sitting there sick at the door. You're
That is
absolutely
not the same
right,
as giving
and
healthcare
especially,
to illegal.
and that coverage is for emergency care. If someone comes to the door from a car crash, you take care of that person. And let me tell you, I went through a car crash in Mexico where I got to get rescued and just turn around and see our van explode. The people there just came and rescued us. They took us to the hospital. Never once did they ask me if I was an American or a Mexican. That's because it's something we do for people as a human being.
Right.
You don't want them come in suffering and bleeding to death and just go, oh, no, by the way, are you really a citizen? Are you from
Right.
Ukraine?
I just wanted to clarify that because I think that gets put into the mix when Johnson says things like, oh, well, we're going to care for them. It's not the same thing as giving insurance. It is not. It is simply a humanitarian act done by
care.
Ronald Reagan put that in, if I'm not mistaken.
Correct.
I am also curious. So the House has voted. The House voted on the CR.
Correct.
Democrats voted against it.
They
Republicans
control the
voted
House.
for it.
That's why I'm
and
saying
so it's moved to the Senate. It's in the Senate right now, so people understand.
The Senate
that.
has voted on it, I think, now twice. They have voted on the Republican proposal and they have voted on the Democratic proposal. And they have voted both down. Right. I understand they're not going to take any votes, of course, today because it's a Jewish holiday. And I think they're going to go home and come back on Monday.
And in the case of this, it needs 60 votes, so it can't just ride on party lines as it did in the House. It's got to have bipartisan support,
Correct.
And that's where part of the sticking point is now.
Right. And so Johnson has said we're not going back to Johnson, the Speaker, until the Senate does something. So I don't know how long he plans to just keep us not at work in Washington. I just think it's shameful. We should be there so that if the Senate does something, we can immediately, because it's about protecting the health care of all Americans.
You're listening to Hello Houston. We are speaking with Democratic Representative Sylvia Garcia. You can join the conversation at 713-440-8870. We do have Roberto from the Museum District on the line. Roberto, welcome to Hello Houston. What is your comment or question for Representative Garcia?
Thank you. I am so disgusted with the Democrats and Republicans playing games. Now, I'm a history teacher. From the founding of our country, even before the founding of our country, the Declaration of Independence, all that, every time, compromise was involved. That's the solution, compromise. What do you want in particular? I don't know. Work it out. But I definitely think there should be term limits on representatives and senators. You get too cushiony, too comfortable in your positions. Oh, you argue very well. Most of you are lawyers. That's what you do. You argue. You take turns arguing. Now, I'm going to bring one thing up. We have very short memories. We go from one crisis to another. I still haven't gotten over the fact that it was covered up that our president, former President Biden, really has dementia of some type, obviously, by now. That's forgotten. The what do you call her? The lady from Haiti who spoke for Biden, she written a book, finally telling the truth. And also this, while you are bickering over basically trivia and making yourselves sound good, you take turns sounding good. But by the way, Biden did what Trump did. He started writing out executive orders too. So you don't improve by coming into office. You're when you get power, you're just as bad.
Roberto,
I'll let you know one more thing. I have to say it. While all this bickering is going on, there's still a Gaza genocide going on from our ally, quote unquote, Israel. Okay?
Roberto, thank you for those comments. Representative, your reaction to anything Roberto said?
Well, I don't think it's just bickering. I mean, it really is about protecting people and saving lives and making sure that people have health care, access to good quality care. And if there's, it's, you're right, I am a lawyer, but to me, it's not just about arguing. It is about saving those people's lives again. We've got a wonderful medical center. Even our medical center will lose millions and millions and millions of dollars of research. The person right now is impacted because they're worried because their child is sick with cancer. They need that Medicaid. But to cure that, it's the medical centers that do the research, and they're even stopping medical research. And we have one of the biggest hubs in the world right here at our doorstep. and they stand to lose probably the highest number of dollars of any other medical research hub in the country. And when you talk about those things, to me, it's not bickering. It is about making sure we take care of people. You know, I tell people I'm a Matthew Democrat. I was raised Catholic and a Christian, and it is about taking care of the poor and the sick and the elderly, and making sure that the least among us have what they need. It's about humanity. And I'm sorry, sir, I must disagree with you in part.
Let me ask you this, shifting a little bit. You may have heard that ICE has said they will be at this next year's Super Bowl because Bad Bunny is going to be this halftime entertainment, and he's from Puerto Rico. He's an American citizen. He is very outspoken against the current administration. What's your take on that ICE is going to wait outside the stadium at the Super Bowl?
I think it's ridiculous. I think it's a waste of money, and I think that we should do something about ICE targeting what we call safe places. Under this administration repealed that part by executive order, and we need to talk about executive orders because he said that. There's a regulation in immigration law that enforcement where you did not go to safe places. Schools, hospitals, churches, funerals, courthouses. Those are places that should be safe for people to gather and do their businesses. I mean, why raid a funeral home, for Christ's sake? You know, it's just inhumane. It's crass. Targeting, Super Bowl, I think, would be very disruptive and create, frankly, an additional security nightmare for the host city because it then brings potentially protests and all that. I mean, why add that and put more people at risk as a target for any potential domestic terrorism or any other kind of violence? I think it's abhorrent.
Well, while we're on this subject, you may have seen the display in the 2nd Ward, and I think your district covers at least part of the 2nd Ward.
No, 2nd Ward is in the 18th.
Is in the 18th? Mm-hmm. You heard about this person who's displaying hanging ICE agents, like with a noose in his
No,
yard.
I didn't.
And next to these hanging ICE agents is a person in a serape. And he's saying this is his Halloween display in his front yard because that's what he's afraid of. That's what his people are afraid of, the ICE agents. It's pretty gruesome. But we won't go there if you haven't seen it. But it's right here in Houston.
I had not heard that, and obviously after the show, if you'll give me the address, I might go by. And again, that's as abhorrent as some of the memes and the tweets that some members of Congress make about other members of Congress, which I think are abhorrent. Or a state representative, I forget what, I think it was from Arizona, asking for someone to just kill Representative Jayapal. I mean, for whatever reason, and you can start trying to play the game of blaming someone, but the reality is there is just more violence and more violent rhetoric in this country that has been around now for the last 3 or 4 years that, frankly, I think are attributable to the rhetoric and the nonsense coming out of the White House.
Representative Garcia, I do want to continue to talk about District 18 in a second, but I want to go back really quickly to the government shutdown.
Okay.
During this shutdown, is your pay constitutionally protected? Will members of Congress continue to get paid?
I believe we do. I don't know if it's constitutionally protected or it's by law. I really couldn't say. I do think that we do continue to get paid.
Do you think it is fair that given the fact that you all will continue to get paid, that you all are actually putting others right now in basically not in a situation where they will not be paid?
No, let's be clear. Employees are paid through the end of this year. They will get retroactive pay. No one would lose any money. They are furloughed. It simply means they're working without pay when it's time for them to get paid. But right now, they're being paid.
Okay.
And we don't know how long it's going to last. It's my hope that it doesn't last beyond the timetable that we have to do what we have to do in Congress to make sure that they get paid beginning November 1st. They will get paid retroactively in either case.
You keep referring to furlough, but if I'm not mistaken, the White House is saying they're going to move in and start terminating jobs, that they're using this as an opportunity
Well,
to
they have
reduce
no
workforce.
real legal authority. Being in a furlough situation or a shutdown doesn't give them any authority to lay off or fire people. Now, whether he'll do it and just let us sue him, which is what he does with every executive order. Remember, executive orders are not law. Executive orders are simply sort of guidance. It's no almost. I compare it to like an attorney general opinion. It's one attorney general's opinion. But the reality is that he has, contrary to what the gentleman said in his call, Joe Biden probably didn't issue more than maybe 100 executive orders. This president has probably issued 100 every month because he is governing through executive orders. Never before in history has that ever happened. And people around him treat it as like a law until we go or someone else goes to court to say he can't do what he wants to do.
If he terminates these jobs during this period,
there will be lawsuits. There will be lawsuits.
People are still losing their jobs during that time.
Well, it depends because most of those cases, if you look after the executive orders that he has signed already, the courts have ordered him to let the employees go back. He has lost almost. I wish I'd had my little cheat sheet here of how many lawsuits we filed and how many he's lost. I mean, even the one of trying to get rid of the member of the Federal Reserve Board, even the Supreme Court said you can't do that. Mm-hmm. So a lot of executive orders end up being reversed by a court somewhere.
So let me ask you this. This is about health care rates affecting small businesses. Mark from Cyprus is on the line.
Okay.
Mark, what do you have to say to our representative here?
Thank you so much. It's a pleasure hearing from you, Representative Garcia. So I'm concerned about the cuts to health care. To give you some context, the ACA, it allowed me, a small business owner, and other small businesses to be able to provide health care both for ourselves, our families, and a few employees with the subsidies in place. With the cuts to health care, it's very likely that those will go away, and there could be significant impacts to small business. I do think the job of Congress is to fight for their constituents. Nobody wants a shutdown, but if the Democrats will stand up and fight for this one issue that will affect all Americans. To put this in context, I received a call today for an appointment for my father, which was going to be a telehealth appointment, and I was told that due to cuts in the recent bill, that wouldn't be covered anymore. So now I'd have to leave my job and drive him in order for his insurance to kick in. And he's also on the ACA. So these are real impacts to real Americans. At least that's what I'm experiencing in my small space. So my question, Representative Garcia, is speak on the potential impacts of not getting this healthcare subsidies back online for all Americans and what the broader impact would be.
I'm going to cut you right there to give our representative a chance to respond to it. But if in your answer you can also talk about how these cuts are going to affect, and the shutdown is going to affect all of us in our daily lives.
Well, it does impact not just the individual who like myself that gets health care through the Affordable Care Act. A lot of employees, a lot of institutions, a lot of businesses all around us have coverage through the tax credits. If I'm not mistaken, I think for the first time I've gotten a letter from the Greater Houston Partnership asking us to renew the credits because, again, it impacts business. So if you have to pay for more insurance, that's going to increase the cost of whatever it is that company produces or whatever their business is. So it'll impact us indirectly as consumers. You add that to any potential tariffs that have impacted the cost of goods and services that are increasing costs, again, it just is about increasing costs. And that's another reason, of course, that we've been fighting to protect your health care, but also working on reducing costs, because we all know that the biggest challenge all of us have daily is every time we go to the grocery store, every time we go to the gas station, or we go buy something, there was people who had trouble just with their back-to-school items for their kids because they saw the skyrocketing prices because so much of that is imported. So yes, it's about all of it, and it does impact all of us.
So, and just to before I'm going to grab a call in 1 second, but I guess I'm still on the sticking point of, as long as if you vote for the CR, and then you have a chance to negotiate all of this through into the new bill that will come into the new pay structure support, why not take these 7 weeks to do it? Is it simply because there's a lack of trust now that they will negotiate in good faith?
Yeah, because in the last 8 months, it hasn't happened, and they don't give. I mean, I'm not at the negotiating table. I'm not Hakeem Jeffries or Chuck Schumer, but I don't see any real willingness. Any contract, Ernie, it's just like anything else. When you buy a car, you buy a home, there's got to be a level of trust on both sides, and I don't think there is. And then secondly, you have to make sure that once you sign the contract, that it's enforceable. Mm-hmm. And I didn't want to get a lot into the minutia, but let's assume that we said, okay, and then we come to an agreement. And then the president says, oh, no, I want to rescind that part. Oh, no, I want to pause that part. Oh, no, I'm going to cut that part. I mean, just look at New York. $18 billion, they announced yesterday that they're not going to send New York for their tunnels. Just yesterday, shutdown number one. And that was something we voted on. Excuse me. They've already done the design. They're ready to go. Why? Well, maybe it's because Chuck Schumer and Hakeem Jeffries are both from New York. Mm-hmm. We don't have guardrails. Even though we may agree on something, vote on it, then he just decide he wants to do as he damn well pleases anyway. Well, no, we're not going to agree to something and say that, yes, it's going to be for the tax credits, and then him turn around and instead do tax cuts for the billionaires. We want guardrails. We want to make sure that what we say and agree to, just like any contract, both parties agree to, that then you can move forward and that there will be some sort of not sanction, but it can be enforceable. So it's a little more than just saying, well, okay, fine. When you've had a history of 8 months of not coming to the table, remember what I said earlier. This last meeting last week was the first time he'd ever met with Hakeem Jeffries.
You're listening to Hello Houston. Doug from Katy is on the line. Doug, what is your question or comment for Representative Garcia?
Well, Representative Garcia, I got a chance to read Project 2025 because I'm an older individual and I can't get hired because of age discrimination. But what I did take a look at was I took a look at all the missions for all the departments that's inside there. And one of the questions that I have for Democrats is this, is how come you guys aren't taking a look at cutting the budget deficit? I took a look at the agreement, and the only thing I could take a look at when I take a look at Project 2025, it isn't perfect, but one of the things that I saw was, why can't you combine the Energy and the Interior Department? They have similar missions with regards to safeguarding parks, but also for developing our resources. Secondly, why don't you combine Health and Human Services and HUD and call it the Department of Citizen Support? You could cut some money that way, but nobody's ever discussed that. I wasn't a particular supporter of DOGE. I thought it was a waste of time. But those, if you took a look at it and maybe you got your inspector generals involved, maybe you could have some real savings into government.
Thank you, Doug. Representative Garcia?
Well, first of all, you need to remember that one of the first things he did do the first day, although he said he was going to cut grocery prices down the first day and he didn't, what he did do is fire all inspector generals because he doesn't want any accountability. He doesn't want anybody telling him what he doesn't have to do, so he fired them all. Secondly, I haven't really looked at those two proposals of the Project 2025. I must admit I didn't read the entire Project 2025. I read the executive summary and then just skimmed through the chapters that were of interest to me. But it does appear that he is following that as his playbook. In fact, yesterday he mentioned it again about Project 2025. So remember, this is his first year in office. He may yet do what you're suggesting in year 2 or year 3 or year 4 of his presidency. There is still time. And that doesn't mean I support the proposals. I'm simply suggesting that it's 8 months. He still has 3 more years to go. And my understanding is that he is going to go through all of the recommendations of Project 2025. And most people are calling what he's suggesting he's going to do with the shutdown to lay off more employees and fire more employees, that this is sort of like Doge 2. That they didn't quite complete everything they wanted because Elon Musk decided to leave. So instead, they're going to use this as the excuse to do more firings in the federal government.
Representative Garcia, as Houston's only Hispanic member in the U.S. House, will the redistricting of District 18 have any effect on you as we head into the 2026 party primary?
And you mean the only Hispanic in the Houston area?
Yes.
Okay.
Yes.
Because just to be clear, there are about
as Houstons.
It's almost 40 Latinos in Congress.
Yes, but specifically Houston's only Hispanic.
No, let's be perfectly clear. The letter that the Department of Justice sent to the governor when he said, I need you to look at these 4 districts, mine was on the list. Mm-hmm. Okay? Yep. So I was the target from day one. Also on the list was 18. Mm-hmm. Which is the district of the late Sylvester Turner.
Correct.
And then Al Green, who's currently in 9, and then Mark Vesey in Fort Worth. So I knew all along that my district was going to get reconfigured in some way. I never expected them to totally dismantle it and abolish the Latino Opportunity District that it currently is. They cut it up in 4, and what's left of the current district in the new map, which is in litigation, the trial started yesterday, that is about 30%. The other 70% went somewhere else, and they took that 70% comes all from 18. So it makes what was a majority in a opportunity district for Latinos sort of a mixed district. In the world of the legalese and all this, they call it a coalition district, which means it's almost like a third. Mm-hmm. So that's where, if the new maps are adopted, and the trial started yesterday, the trial shall probably be about, I'm guessing, a week to 10 days. If they uphold the maps, I will be running in that district. I'm already making plans and already announced that I will run for my 29. And we'll see where that goes.
We will.
U.S. Representative Sylvia Garcia of Texas's 29th Congressional District. Representative Garcia, thank you for joining us today.
This is it?
No.
I was ready for more.
We're just getting started.
I will. Anytime it's sad to know that I'm here because it's a shutdown, but it does give me an opportunity to visit the district, and I do want that address, and I'll be back anytime y'all need me. Thank you.